started the SignTalk Project almost a year ago, and we spent most part of last year doing a review of literature so we can understand the scope and then know the contributions that have been made in this research paradigm. We also spent most part of last year doing community-based feasibility studies and stakeholder engagement, just so we can understand what the speech and hearing impaired folks in Ghana really need as an intervention in their communication. Now, we have realized that most speech and hearing impaired people visit the hospital and they have the challenge of communicating properly with the physician. We also know that some speech and hearing impaired people are able to hire translators, but for most of them, hiring a translator is very, very expensive. So in this SignTalk project, our objective is to bridge the communication gap between those who are speech and hearing impaired and then physicians. We do not want to widen the scope, but we are starting with accessing good healthcare and being able to reduce mortality rates due to medical errors and so on.
The SignTalk Project promotes inclusivity and accessibility by empowering the deaf and hard of hearing community with tools for effective communication, and also demonstrating how AI can be used for social good, especially in underrepresented communities. In essence, the SignTalk Project is not just a tech solution, it's a human-centered innovation that advocates for equal participation and dignity for all.
Before the start of the SignTalk Project, we had a stakeholders engagement meeting. I had the opportunity to engage with persons with total hearing loss. In this engagement, I realized how important it is because I tried to communicate with them, and for the first time in my life, I felt the weight of not knowing how to communicate because I didn't know any sign language. I already had an idea of how important this project is, but this also gave me an eye-opening experience of how impactful and powerful this initiative is. Now we start this project and I'm motivated because I think of it as having a situation where it's life and death. Then how am I supposed to communicate without having any idea of how to sign? This SignTalk project is going to help bridge the gap, and our aim is to start from the healthcare sectors where the stakes are high.
So far on the SignTalk project, we've been able to build a lot on our problem-solving skills, programming skills, and we've also learned a lot in artificial intelligence. Personally, as a data scientist, my expertise was more on data analysis, predictive modeling, and large language models. But looking at the nature of this project, that's a SignTalk project, it has made me move from my comfort zone into computer vision, where we are learning a lot of interesting stuff.